Hi, I'm Katie Swafford with the MD News Network. We're here in the windy city of Chicago at the AMA, CMA, BMA International Conference on Physician Health 2010, talking to doctors about physician health and resiliency in the 21st century. Here's what they had to say.
Well, clearly not enough time to do everything that they want to do. Sometimes it's reimbursement issues and not getting paid for the kinds of things that are really the right thing to do. And I'm biased because I'm in the field of lifestyle medicine, and a lot of those kinds of coaching and counseling that physicians and nurses and need to be doing are not paid for, and physicians who really care about what they do have to either do it pro bono on their own, and that stresses them out, or kind of feel guilty that they're not doing it. And then, of course, paperwork and insurance rules and changing insurance, and now we've got healthcare reform, and that's clearly stressful for the entire healthcare system because we don't really know how that's going to be interpreted or implemented and what that means for the lives of physicians and all of us.
Well, there are so many. It's hard to go through. But medicine in the United States right now is going through such a major crisis, and physicians are finding their practices are undergoing radical change. The malpractice crisis is increasing, and that's causing more pressure on physicians. They are, because of reimbursements and decreasing, they're having to increase their productivity, and physicians are just having a lot of pressure put on them, and it's very hard for them to balance all of those pressures, plus being able to really take care of their patients the way that they want to take care of their patients and still have a life.
Well, certainly anything that challenges physician control and autonomy, and there are a lot of things that do so these days. The ever-expanding numbers of roles that physicians have, particularly those that call them to do things that they weren't taught to do during medical training, like lead teams, promote resilience in the wake of organizational change, and all the while try to achieve that mythical balance, which no one really achieves, but that has become in some ways a new age guilt that just significantly complicates the well-being of physicians and their families.
I would say the biggest stressors are the hours worked. Most physicians work way more than 48 hours or 58-hour week. In fact, if you survey them, they're up into the 60, 70-hour way. The second is sleep deprivation, and the third is obviously an imbalance in life. They're not part of the family unit.
Issues of stress really are different based on population. So medical students talk to us a lot about how do they maintain relationships in medical school, how do they plan their families, how do they manage their incredible debt loads, how do they choose a career. For residents, we hear a lot of themes about how do they sustain their marriages and relationships with significant others in light of working absolutely ridiculous hours. How do they pay off their debt? How do they establish a career? And when I think of our faculty members, we have, no matter where you go, we have an incredible richness of supervisors and professors in medicine, many of whom are trying to negotiate having a sustainable life and an incredibly wonderful career. And we hear a lot from them that they need things like coaching and mentoring and career support that I don't think we do a particularly good job of currently in medicine. So I think the privilege is great, the opportunity is great, and what's even more wonderful is the interventions actually aren't that complicated. These are things that we have the capacity to do. So roll up our sleeves, a little bit of elbow grease, a few more resources. I think we can have a significant impact on the profession.
Well, for me, the bigger stressors are time pressures. I would like to have sort of the fullness of time to do each task in front of me, and I don't know if that's super different. I have a feeling it's somewhat different from the way it used to be, so that would be the biggest one.
Well, that's a great question, and I think just looking at the studies, but also just talking to people, number one is often loss of control. You can have a high demand practice, but if you don't have control and choice, then your stress is greatly increased. the excessive paperwork and time that's really not ultimately paid, where you're doing things that don't really increase patient care but take up your time. And the risk of a malpractice suit is something that's hard to quantify, but it's always present, that burden, knowing that you could just make a slight mistake, but it could cause significant harm. I think that's weighs every day, and it's nothing you can really turn off.
The main stressors, I think, is the work pressure. I work with a lot of patients with very difficult problems, with very high demands, and sometimes the managers don't understand the kind of the job I as a doctor do. So I think this is the most important stressor factors.
Now that you've heard the conference attendees' opinions, we want to know what you think. Click on Share Your Perspective at mdnews.com.